Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Yeah, so we all pray that it'll be successful.
Mm.
Yeah.
Yeah. He is a great player.
Yes, he was. College and pros.
He has a Nigerian name.
Otumbo. Oh.
It's from the
Motumbo.
Congo, though. So
I think it's from.
from the Congo.
Yes, exactly.
Okay, well, he's been a great humanitarian.
Oh,
Yeah.
Yes.
It's an interesting article that I thought would be of interest because we haven't talked in a while about what the patient says they want you to stop doing anything for them because they're ready to die. And we talked about many states that allow you to physician to help you pass away or die, and the many states that do not allow that. For example, the district at one point had legislation that allowed you to do that, but there are very few states in the United States that actually have that on their laws to allow the physician to assist the patient to die. Remember, Dr.
Kevorkian.
Kevorkian, who considered himself a humanitarian because he felt that people who couldn't be helped by pain medicine and who were suffering should be assisted in death. And for that, he was put in jail, and he felt akin to those people who sacrifice themselves and die unjustly. He was put in jail, and he still, to his death, he felt that it was the right thing to do. That there's certain people who, when they no longer can be helped, should be allowed to have euthanasia. And in some countries, as you see here, it is legal. In Colombia, Belgium, Canada, and Luxembourg, but it's not true in most of. And this is the states, United States, that including D.C., that have legislation passed. Yeah, and so, what are your thoughts about this? Because this is something that has been discussed for quite a while. And the AMA has adopted a position that doctors should not participate in the assisting people to die. Some would argue that what they do when they go to palliative care is akin to that. But anyway, what are your thoughts about that?
I believe it's the right thing to do to help someone, the doctor to help someone.
Dr. Callender, isn't this similar to what we were talking about before with the notice that you have to fill out, to
No, because that doesn't say that they help you die. That allows them to do whatever you want them to do, whether that, because you then decide whether you want to be on a ventilator or not. But assisted dying is where the doctor plays a meaningful role in your death and gives you medication and that kind of thing, which is different from your saying what you want to be done to you should you get into a situation where you need cardiac cardiac CPR and those kinds of things, of ventilation. So it's very different from assisted death, euthanasia, as it's called. Because what it is, and according to Hippocrates' oath, we don't not supposed to hasten death. We're supposed to delay it, not hasten it. And so that's why there's a lot of debate and discussion about whether or not it's the right thing to do. Any other opinions on the subject? Because it's a patient right to decide what should be done to them at the end of their days. And this is one area where the patient's autonomy may not be respected because of the laws, the laws of the land. Any other comments or thoughts on this?
Yes, again, good morning, everyone. Dr. Callender, there's a resource from NIH, Tips for Advanced Care Planning, that was referenced in the question.
You have a comment about it?
Yes, it just gives you all the guidelines and information about it.
Yeah, do you have any thoughts about it though? I mean, I understand what they think.
Oh,
What do you think about it?
I'm on hold right now on
Okay.
that. You know, I'm trying to get over the advanced care planning first before, you know.
Anybody else have any other opinions about?
I had a question. Does morphine play a role in this? I mean, can they continuously give a person morphine until they can't take anymore?
Well, that's why I said the palliative care people. Some would argue that that's what they do anyway, because when you go to palliative care, if you have a lot of pain, they give you pain medicine, whether it's morphine or Dilaudid or whatever. And some people argue that that's what they're doing anyway, because they give you so much pain medicine that you stop breathing. But that is not a deliberate attempt to kill you. That's an attempt to relieve your pain so that you don't have any more pain. So, but there are those who would argue that that's exactly what they're doing.
So my question, Doc, going back to the advanced directive, which I couldn't remember. There's no place in there where you could specify, you know, the quality of life that you would have and what you would want done in the case where you can't eat, or there's no hope for recovery.
Well, you can express what you want done in your advance directive, but it doesn't say there that the doctor has to assist you in your dying. That's the part that makes it different, because euthanasia is where the doctor plays a role in assisting you in your demise. When you decide that you don't want to, that if something happens to you and you're in the persistent vegetative state and you don't want to be forced to eat or any of that kind of thing, then you can do that. And then that becomes very important. You're in a persistent vegetative state if you've already expressed yourself, said you don't want to have anything else done. But that's different from the doctor assisting in hastening your death.
Okay.
But that's what you can do to try with your advance directive, to try to let people know that you don't want any extraordinary measures taken should you become in a persistent vegetative state or something like that. Any other thoughts on the subject?
Dr. Calendar's Carol Tatum. I was just wondering, they could put you in a comatose until the time passes for you to pass, but this way it just, if they assist you in dying, it's less financial for the patient, or is that taken into consideration?
What was your comment? Was it less?
Does the financial responsibility, does that fall upon anybody? You know, if the doctors do help you to pass away quietly rather than put you in just a comatose.
No,
state.
if you do it in those states where it's legal, there's no financial restriction.
Okay, so who's responsible? Someone is suffering for a long time. Who's responsible for those financial bills?
Or the person.
Oh, so once they die, they don't have any financial responsibility, right?
Well, probably their spouse might. The spouse might, because the two of you are one. So the spouse might, but in terms of whatever bills you acquire, yeah, those are bills you acquire.
So in Christianity or different religions that they frown upon suicide, I guess those are the states that are really against it.
Well, you saw in that article, and that's the number of states that are allow it to happen. The burden of the situation is on the physician, and that's you see here the states that have legislation, and those states, the doctor can aid in the dying process. In other states, it's illegal for them to do it.
Mm.
So another question. Job in the Bible, it got to a state where it was excruciating and he wanted to die. And and the argument came up, well, he ended up living a better life afterwards if he only had endured the pain and suffering. But I think this is different. There's acknowledgement that these people are going to pass anyway, without, unlike Job.
That's correct.
Okay.
Okay. We don't want any other thoughts on the subject.
I've always wondered, Dr. Callender, what God thinks about suicide.
Well, I guess we have to wonder, because I don't know any source that addresses it.
Well, we got Darryl on the line.
What?
He's not been deified or canonized yet.
Yeah, I know, but he probably has an opinion on what God thinks about suicide.
He can't tell us what God's feeling is. He can tell you what.
Come on, Johnny, give me a break, man. But one thing we're not talking about is, part of that article was talking about one patient that starved himself to death because he was so miserable, and it took him 12 days to starve himself to death. When you're that miserable, it's just extreme cruelty to keep on living. I think like the measure of humanity is how kind you can be to yourself and your fellow man. If there is a way for a doctor to alleviate the cruelty that life is having this person experience, that means that by all means we should do something to help somebody out of their misery. Even if it means the untimely termination of life. And so
that's why Dr. Kevorkian was put in jail, because he felt exactly as you did, and as many do, that that's the kindest thing you could do. And that was illegal though, so that they put him in jail for that. But you expressed it exactly as he had expressed it when they put him in jail.
Dr. Callender, tell us about when you were on a show with Dr. Kevorkian on the Oprah Winfrey Show.
Yeah, Dr. Kevorkian and I were on a couple of television shows together. Not Oprah Winfrey though. We were on I forgot the other guy's name, but we were on a couple of television shows.
Phil Donahue?
Yeah, I think that's who it was. Yeah. And it was Donahue. And I felt he sounded to me exactly like Darryl did. He was a kind person, and he wanted to do the right thing, and he expressed it in a very humane fashion, and I empathize with him completely. He expressed it exactly the same way Darryl expressed it, that it was inhumane to not let those people be relieved from their misery. And he actually felt he should be canonized because of his position, the fact that he was put in jail because he wanted to do the right thing. That Darryl expressed so
He
articulately.
thought he should be a saint.
Yes, he should. That's exactly right. He felt that he was being just like the Joan of Arc, who was
Oh, okay, okay.
crucified and burned at the stake for being honest. He felt he was going through the same thing, and he felt that's what he said, that he was going through the same kind of persecution that Paul and the others were. So, and it's all how you look at it.
Yeah.
Anyway, I thought it'd be interesting to discuss this because it's something that we're all going to die, so it's something worthy of discussion.
Dr.
Well,
Callender, didn't Congress didn't they stop that from becoming a law in the district?
Yes, they did. Congress stopped it.
That's another reason why the district needs to get to be a state or an entity.
Yeah.
That's cruel and unusual punishment too. Every time they do that to us.
Yeah, you're right.
But society is cruel. I remember having my first child, and the way it would say natural childbirth, and doesn't matter how much pain the mother's experiencing. And he said, mankind has come a long way. Why experience something when you don't have to? And the same thing with abortions of mothers that are going to die if they give birth to a child, and there are people that are saying, well, let her die because you don't want to kill this unborn child. So mankind, in a way, in a way cruel. They don't care about whether people have comfortable lives or have to experience a pain. And the same thing about the racial issue, about that certain people can endure more pain than others. So mankind, just their way of thinking about pain, as long as they're not experiencing it, everybody else, they can experience it as nothing to it. Like women should be able to experience more pain than men.
Well, I think that's a generalization, and I think generalizations generally are not appropriate. Yeah, because I mean that's just man's inhumanity to man, and there's no justification for that. That's just to me, that's just the devil's work, and not anything that God has ordained. It's something that we've done in our ignorance.
Yeah. When it comes to what God's ordained, you have to remember the commandments: love the Lord with all thy mind, heart, and soul, and love thy neighbor as thyself. So when you love your neighbor as yourself, you have to be kind.
Well spoken. Well spoken. Next one, next article, please. Now, this is a warning to us that flu season is likely to be severe. So we need those who are willing to be vaccinated need to get their vaccination for the flu. Last year was relatively mild. It is expected this year is going to be very severe. Whether they're right or not, we shall see. It was particularly bad in Australia and down. They think, therefore, it's going to be particularly severe here in the United States. So the moral of the story is get your flu shot. And now's a good time, the end of October, early part of November, before Although they say the flu, as you see here, is starting earlier than usual, but it's on its way. How many of you had already got your flu shots?
I have.
I have.
Good, good. Getting
I
mine.
have.
Good, wonderful, wonderful, good. Getting mine on Saturday.
I'm scheduled next week for mine.
Good, good, good.
Well, Dr. Callender, part of the rise in flu, I think, also is the relaxed attitude that people have about hand washing and mask wearing and social distancing, which we had with COVID, of course.
Yeah, I agree. Yeah. Okay. Oh, I think we have another article. Now, this is an article that I was expecting. This is it's interesting. All of the minority groups are more likely to be hospitalized and less likely to be vaccinated. So we want to not make this come to pass. Oh, I've got to plug my computer in. I think this article pretty much speaks for itself. You say that vaccination is the best defense we have. And as we said many times, the flu kills thousands of people every year. We don't want to be in that number. And remember again that if you're 65 or over, you get a double dose, not just a simple dose, the double dose. Because our immune systems over 65 are not as potent as those under 65.
Dr. Callender, do you think that if we had thought of, social distancing and, hand washing and all those things and wearing masks, especially during those years when the flu deaths were very high, do you think that would have helped?
Yes. As a matter of fact, if you look back at when the flu epidemic first occurred in 1918, that's what they did. That's what they did at the time. Was wear masks. That's all they could do. They didn't have any vaccines, so they did that. Carl, your hands up. Oh, okay. Okay, so now this is a perplexing article in the sense that this is what's going on. It's sad that in this country, which is one of the richest countries in the world, that we have people who can't afford to pay for the insulin, so they ration the drug. It's kind of embarrassing in the United States that this is an article but it's true. The price of insulin has gone up, and there's some diabetics who can't afford it anymore. And so they have to delay and skip doses, which of course makes them more likely to have deaths from uncontrolled diabetes. This is tragic here in the United States. This is the situation, unfortunately. But this is a fact of life. The price of insulin is going up and up, and as expected, the Black and Hispanic populations are doing more of the rationing than others, although it's really a poverty issue. And the interesting thing about it, most of the people in this country who are poor are what ethnicity?
Dr. Callender.
No, first answer my question. Okay, what ethnicity most poor people.
I say
White,
black.
Black,
white,
Spanish,
black.
Spanish.
White,
white.
Mm.
right, because there's a larger number of whites. But
Wow.
okay, go ahead, answer the question. But I just wanted to point out that most of the poor people in this country actually are white, not black or Hispanic.
Hmm.
Go ahead, Janice.
No, I have a question regarding animals, pets. And oftentimes, especially now, recent years, you see the care that people give to their pets. The insulin that an animal would receive, that's the insulin that we as adults receive, correct?
Yeah,
Yeah. I say that because, of course, my son and the kids had a dog that they truly loved, and they did everything they could to prolong his life. And he was a diabetic, and they didn't have much money, but they made sure he had the insulin. He had the shots, the needles, and we got to go out and get some more medicine. He went blind. I mean, they did everything. But I remember that insulin, and they were saying that it was expensive, but they got it. They got it for him. And of course, all of that happened too during the pandemic. So it was very traumatic watching them care for their pet. And then the fact that when they had to finally put him to sleep, they couldn't all go to the vet to be there to comfort him.
I know I was just coming
Dr.
over to I'm typing an email and was Bernarda.
Gozium, your friends are unmuted.
okay, so
Anyway, Dr. Callender, I was just wondering if it was the same type.
Okay,
Yeah,
thank you, thank you.
interesting point you bring up because
Mhm.
taking care of pets is expensive,
It is,
even if you have insurance for pets and they have
yeah,
pet insurance.
right.
But yes, same as them.
Dr. Callender, last week we talked about this bionic pancreas
Yes,
that hasn't been approved by
Yes.
the Federal Drug Administration.
yes.
Well, it seems as though that one is going to be very expensive because, as you told us last week, it has built-in insulin.
Right. But one of the things about that is that if your insulin pump gives you a hemoglobin A1C that's less than 7, the bionic pancreas doesn't do any better than that anyway. So it depends upon how effective your insulin pump is. If an insulin pump that keeps you above 7, then that's different. But if it keeps you below 7, then you could stay on the insulin pump or the bionic pump, because you're right. Anything new like that is going to be very expensive. Yeah. Any other comment about the insulin article? How many of you feel ashamed that in the United States this is an issue?
Yeah,
Oh,
definitely.
yeah.
Sad. It's sad.
What's the profits of the drug makers?
What is your question? You
What's
know
the
the answer.
what's the profits of the drug manufacturers?
Huge,
Yeah,
huge.
Isn't it called Big Pharma?
Right, right.
yep.
Yeah, it's something that needs to be addressed.
Well, we talked about it before. We're probably the only major country in the world that does not have universal health care.
Yeah, it's sad. We talk about it, but not so far, nothing. And Joe Biden has a plan for it, but it hasn't happened yet. So the sooner the better. Now, this is an article that isn't a surprise. At any age, a healthy diet can extend your life. Since we have food deserts and we have McDonald's and all those places and junk food,
Come here.
it's still not too late, no matter how old you are, to eat the right foods. But when you get used to eating processed foods that are unhealthy, getting back to adopting a healthy diet becomes harder to do. The older you are, the harder it is to do it. But this study just points out that something is obvious as night and day, that the more nutritious the diet you have, that it's more fruits and vegetables and less red meat, the better off you are. And this is something that Darryl has been trying to preach forever. And it's all the data is proving that that's exactly correct. However, the question is that going to stop people from going to McDonald's, going to these other places? No, but at least we should make it easy for them to have healthier diets and to eat more. But we can't force them, so. And these are ways to eat healthier and get off of the meats, adding the nuts, grains, beans, and peas that are better for you. Well, we say that people are dropping dead every day from heart attacks and other things at very young ages, 40, 50, and 60.
Dr. Callender, I wanted to mention that all these photos right here have links to the recipes for these healthy dishes.
Good.
Dr.
Let me
Callender.
on this. We have so many of our older relatives that lived into their 80s and 90s and eating lard, bacon, all the high fat. We say fat is. They ate all the high fat foods that they could, fried chicken, but they lived into their 80s and 90s and lived pretty healthy until they died. But the main difference is back then, everybody cooked. You didn't eat out all the time. You had home cooked meals. You ate real food instead of processed food. These days, it's more the norm than unusual for young women to say, I don't cook anymore, or young men. Nobody cooks. They eat out. And the eating out is what's really killing us. That promotes the processed food and the bad diet with added sugars, which is usually corn sugars, fructose, and it's just having a terrible effect. But if we could do anything, we got children, grandchildren. Our legacy should be making sure that they all learn to cook.
I think it's an excellent point, Darryl. However, I don't know how young people take it. How are your grandchildren taking that concept, folks?
They eat a lot.
But are they cooking? That's what it's
Yeah,
for.
they cook and they eat it.
Okay.
They're not, and I
They
think it
cook a lot
affects
and they
me.
eat a lot.
Yeah.
I taught my boys hello, good morning, everyone. I taught my boys how to cook. So our family, each person has a night, my husband, and my two sons. And so my youngest finds himself looking at Chef Gordon Ramsay all the time to get his recipes. But that being said, I'm now going to have him look at a more healthier option as far as cooking healthier, because he'll like, can I get a ribeye steak or something like that? That's what he wants to make. But I appreciate listening to that because, making healthier choices does start when you're younger. Hopefully that helps them when they get older, and that'll help our family as a whole.
Thank you.
My grandchildren are beginning to learn how to cook, especially the older ones. And every once in a while, I'll ask a question, especially among the young men. The girls just love to come in and help me cook, especially on Monday nights, or just preparing a fruit salad or something like that. But the young men, I'll just ask them, what can you cook? And they'll tell me what they can cook and what their mothers allow them to cook, whether it's breakfast, scrambled eggs, or whatever. But, just to make it known that everyone should learn to cook, and I leave it up to their mothers to teach them to cook or let them get in the kitchen to cook. So they're learning but sometimes it's whether or not you can microwave something. So instead of cooking from scratch, they've learned how to microwave stuff. So it's just now teaching them how to cook from scratch or without microwaving or nuking something?
Well, I think the youth of today are more concerned with a fast-paced form of life, and they're always on the move. You have a husband and wife who are both employed and working outside the home and have kids, and they don't really take time to sit down and have a meal together. It's more on the rush. Just pick up some fast food, some fried chicken, or bring it home and eat that, and that's it. It's unfortunate, but it's true.
And
I know
I'm on the flip
my
side.
daughter, when my daughter got married, one of them, she couldn't cook at all. However, she grew up in a home where everyone sat down for dinner. So my wife had to create a cookbook just for her basic meals, breakfast, lunch, and dinner. So I know about that.
Janice, you were going to say something?
Yeah, I'm on the flip side of all of that. We're talking about these young kids and their poor eating habits. I'm a senior citizen, and my lifestyle is different now. My eating habits are horrible. I've gone through a series of tests. The main thing that came out of it, do you eat? Of course I eat. Look at me. I eat the wrong things. And my vitamin B level is very low. Now I'm having to take B12 pills every day. So, you just have to, this is helpful for me in trying to understand and eat the things that will be healthier for me. And the bottom line is to cook. I know cooking at home is healthy, but cooking at home for one person is a lot of work. So I have to rethink things.
Elizabeth, you had
Oh, yes. Going back to the article, first, my grandkids are concerned and my kids are concerned. Like the young lady said that everybody, when my kids were growing up, everybody had a day to cook. Whatever your menu plan was, and I approved it, that's what you cook. And there's laughter moment about how they learned to cook. But when it came to my grandkids, to get them to cook, I taught them that cooking was nothing but science. Cooking was nothing but reading. Cooking was nothing but being informed and one of the highest skill on any standardized test. Now, getting back to the article, my only concern is that when they gave the recipes about canned food being used, and we know that canned foods have it's the product that has the most high sodium. And I remember it was brought back to my remembrance about canned food. I remember if most of the time my grandparents ate out of the garden, and then the government came along giving canned foods out when they, couldn't work in the garden. There was no more farm, and they used canned food. But I noticed that my grandmothers, them always took the canned food and they rinsed it out several times. Okay. Then a generation came along after me that didn't rinse the canned food. But going back to canned food has a high portion of sodium. And so you have to use your wise knowledge on portion control to use those products.
okay. Okay, so I think that this has been very instructive. This, of course, they talk about the importance of chickpeas and nuts as well. So,
Well, there's another subject they've taken out of the curriculum in schools. Our generation, girls had home economics and boys had wood shop.
right.
Now, in junior high school, technology and all that has taken its place. And you don't get home economics unless you elected in high school, in some high schools. So, and that's generally now girls and boys, because just like jail, girls and boys because of the time. But children have been, and generations have not been expected to learn how to cook. And it's just been taken out. So parents have to do it, or grandparents, of how to cook. And like you said, taking the time, a busy life, working, and etc. But that's what it is now. education has stopped.
Okay, let's move to the next one. Got a whole lot of others. Now here's another one. People who sleep 5 hours or less a night face high risk of multiple health problems as they age. As interesting as they looked at people who are 50 and over, and actually, as you see in this article, when it goes to 60, it increases even more. When it goes to 70, it increases even more. So sleep is important. And those who sleep 5 hours or less face 30% risk of developing chronic disease. And at 60, it's 32%, 70, it was 40%. So those who don't get enough sleep need to find ways to get 7 to 9 hours of sleep every night, because otherwise obesity, high blood pressure, diabetes, all of these things up here are likely to occur. And of course, Arthur is with us regardless, but I think wise to wherever are the obstacles to getting 7 to 9 hours, they need to be addressed, whatever they are. Any comments on this article pointing out the importance of sleep? We've talked many times about the fact that at night when you go to sleep, the brain decompresses the toxins and all of that stuff. And so that's important for the brain as well as the rest of the body to be restored. If you don't get sleep, you don't get restored. And chronic disease follows, increased inflammation, etc.
Yeah, and I can tell you that one of the things of being on call, definitely over 60, I felt so much, I knew I was deteriorating. I didn't have high blood pressure, diabetes and stuff, but I could tell you that my brain and lack of sleep was definitely affecting my ability to process things. And I could feel like I was losing mental capacity and, you know, at risk for dementia. And so that was one of the things you say you hate to see. And, you know, my mom had dementia, so it was concerning for me to be saying, you know, I'm in this profession where I don't want to get to that point where I maybe physically able, but don't have any mental ability to function adequately. So I could feel the difference, and I know that was an important was important for me to say I got to change the way I need more rest. You know, you definitely know your body needs it.
Any other comments? If not,
Good to know.
well spoken.
Yeah, there was in the article was talking about exercise can promote better rest at night. And a lot of people say, well, I move around, I go up and down stairs, but you know, it's not really exercise that'll help you sleep unless you get the heart rate over 100 and, you know, you do it for the half hour to 90 minutes a day. And so you do the hard work and it'll help you sleep.
Yeah, it's more about sustained exercise, you know, there over a period, at least 20 minutes of having your heart rate above your outside of your normal range.
Dr. Callender, I love the last paragraph where it says things to avoid. Right? It says there it is, avoid caffeine, alcohol, and those large meals before bedtime. My mother used to tell us that if we ate before bedtime, that you have two things going on. Your body's still working and your body's trying to sleep while it's still working at the same time. So you got two things going on. So that's what our mother used to tell us. She would tell us, you can't eat at night. The body has to completely rest. Otherwise, one part is working and one part is trying to sleep. So you got things warring at each other.
It's amazing how our parents and grandparents were so smart, isn't it?
Yes.
Yeah. Okay. Now this is interesting because now they have a law that requires the mammography facilities to notify you if you have a breast tissue density that requires a different kind of mammography in order to find small breast cancers. And so it's now required, if you have a dense breast, that they notify you so that you can get 2D mammography or something else that will allow you to pick up the smaller cancers that may be hidden by dense breasts. This is a relatively new FDA requirement, but it's something we've known for, I guess, the last 4 or 5 years. That dense breasts under normal mammography can hide small cancers. And therefore it requires something different, more precise. Of course, the requirement of mammography for women is something that I think most women are aware of, and so they get mammographies. But what some of them aren't aware of is that if you've got breast dense, sometimes the mammography is not going to pick up the small cancers, and so you need to have special mammograms that will pick up small cancers in the dense breast. This is brought on because there are a number of women who had dense breasts and they had mammography, and the mammography missed the small cancers, and they then recognized that for women who had dense breasts, that they needed to get something more than just a standard mammography. And you know, it's interesting because in surgery, we've had a number of our female surgeons die of breast cancer, and it's a disease that's taken out far too many of our younger Black women. And so whatever we can do to pick up the breast cancers earlier and treat them, and it's something that can be done. And I think this FDA requirement is moving in the right direction. Any comments, Velma or anybody else?
Yeah, it's definitely something that needs more education and more awareness, especially in the African American community, and making our sisters and brothers aware of the early risks, especially for triple negative and the more aggressive cancers that we see to be hit with more in the younger Black women. And really sad to hear of the passing of the surgeon who died. It was very, very unfortunate.
Yeah, we've had a number of our female residents who died from breast cancer. Dr. Wilson was the most recent one, but we've had a number of them through the years, beginning with Lois Young, who's an ophthalmologist, and many others. So that
Dr. Callender, I have a friend that was a male that was diagnosed with breast cancer. So I was just thinking that a male would have really dense breasts if he did have that. And it was very late when he was diagnosed, but he was treated and survived.
yeah, I'm glad you brought that up, because sometimes people forget that men have breasts and they also develop breast cancer. And that's why examination of the male breast is important as part of the physical examination. This is an interesting article because the race gap is in U.S. infant deaths is there already, but the race gap after fertility treatment is even double. So that's the black-white disparity exists without fertility treatments, but with fertility treatments, it becomes double. And that's, of course, as we have women who have difficulty giving birth to children, and they start taking these fertility treatments, it appears that for people of color, this doubles the risk of fetal mortality. So, and then this, as you go down, you see that we are at risk for many things, but the fertility treatments that we get to try to have children, we suffer disproportionately more than other ethnic groups. Not sure why, but the data, they looked at more than 7 million US births, and they were able to identify 4 times higher in babies born to Black mothers. And of course, we're already twice higher in Black moms anyway, but then with fertility treatments. And so it's interesting, whatever we do, we, for some reason, and the social determinants of health may be a major reason, but we still, bottom line is that we're more at risk to have infant mortality.
Dr. Callender, you know, it sounds, 2 things come to mind for me about this article, and that is the fertility treatment may be inferior. That's one thing that comes to mind. And the other thing that comes to mind is a conspiracy theory.
Well, the fertility treatments are infertility treatments. They're not different for anybody else. The question is, when you say conspiracy, what's the conspiracy theory that you have in mind? But anyway, the IVFs, the process of fertility treatments is pretty standard. And it's the same for people of all ethnicities. Why it results in a doubling of neonatal mortalities is something that I wish we knew the answer to. Any other thoughts from any of you women in the audience? Now more and more people of all ethnic groups are getting fertility treatments and having children. Helpful thing to know if you're dating someone with depression. Well, as Carol Tatum has reminded us, 1 in every 4 of us has got anxiety or depression. So it's very common. So how do you act with somebody who's depressed? Well, I think this article talks about some of the things that you to keep in mind. And actually, when push comes to shove, it's all about caring and loving and helping people to do healthy things, eat the right foods, sleep right, exercise, all those things. Things of common sense that help somebody with depression.
With the recent pandemic, more of the adolescents have been deprived of school and association with friends, and that's led to a lot of depression and mental anxiety. So it's kind of hard to separate who is depressed and who's not, unless they act out, you know. It's but that's the real concern.
Yeah, you have to presume that they're depressed. You almost, especially the data on the teen population. Depression is becoming the norm rather than the rare phenomenon. It's a common phenomenon, and so you got to look out for your partner and try to help them. And I think later on in the article it talks about some of the steps you can take to help with your partner. And most of them are common sense things that try to keep them doing the right things, the healthy things, and try to be more understanding and listening, more listening, and less talking about yourself, and more listen to hear what they have to say. And that's something you should do whether you're dating somebody with depression or not. So, but you can go on down to see some of the how do you support a partner with depression, and it talks more about worrying about others, and not so much about yourself. And then I think these ideas about meditating, going to therapy, etc., the stigma goes along with getting professional help cannot be overemphasized. And here's some of the recommendations they make here. Whether they, you can hold this for a minute, whether they do this or not, I think these are some simple things you can do to help your date and your children as they date. You can remind them that, of course. Now we're talking about grandchildren, of course, with Dr. Ivy, you're talking about great-grandchildren, right?
That's right.
Yeah, so.
They're not dating right now. The oldest is 9.
Velma, you have any grandchildren?
Adopted grandchildren,
Oh, okay.
not biologic.
Well, it doesn't matter.
Yeah. Yeah, one just announced that she's bipolar. I'm like, how'd you come up with that? That's what my school counselor told me.
Well, you know, it's interesting now that people are going to psychiatrists that they can talk about being bipolar. Used to be manic depressive, now it's bipolar and other things. So, and I think one of the things that Joe Biden talked about is having more paraprofessionals to address the psychological problems, because we have so few psychiatrists and psychologists who are willing to take care of you unless you have cash. So this is an issue that becoming more and more of a crisis. It was predicted that this would occur as a consequence of the pandemic. Now we're seeing it come to pass.
Dr. Callender, I have a question about sending them a playlist of your favorite songs. The thing about it is your favorite songs. It may not necessarily be their favorite songs. So how does that help them?
Well, you hope it's your favorite songs are their favorite songs. That's
I doubt it.
That's the hope. That's the hope. But that's all you can do. You can't. You don't know their favorite songs, so you send them your favorite songs. If it's much better if it's their favorite songs, and I think that's your point. Yeah, but they may not know.
Dr. Callender, that's very true for funerals. You know, when someone is very depressed because a loved one has passed, and when they request certain songs from the musician that they want to be played at their loved one's funeral. So they choose their favorite ones.
Yeah, I remember when I was recording songs, I did an album. My twin brother and I did an album, and we did a lot of old songs that old people like, and this was something that was good for the older people because they had favorite songs that most people didn't know about, and so.
When you say old people, who are you referring to?
Well, people over 60.
That's better.
Everybody on this screen, that's for sure.
People over 60, yeah. Yeah, because they, a lot of the songs we used to sing, they don't sing much anymore. So when they hear those songs, they kind of think of how it used to be, and that livened them up. It was amazing to see some of the people who were older, who were sick, how they recognized some of the songs, and it made them feel better. So it's interesting. Music therapy, as has been discussed by Carol and others, is important treatment.
Dr. Callender, I love this section because it reminds me of the fact that we as older teachers, we taught the whole child, including the nurturing and the teaching. Because when I look at each of these bullet point, each of them reflect what we did with kids. The fresh air, go play with a friend. At recess, we gave them celebrations where they had to cook certain foods, and we planned the menu, and it was encompassed around all the academic skills. I always played Mozart and Beethoven for relaxing. They had a journal that they would always write about things that they loved. We were always, I will always have, I forget the resource that will come in and talk about different countries and different people and bring in different foods. And then the other thing is, first thing in the morning when my students got in, they had to get up and go tell someone how they feel today. And then they had to get up and tell someone something good about them. So, that's just a part of the old style teaching of nurturing and loving and taking care of that whole child.
Well spoken. Well spoken. Okay, let's move on. We got a whole lot more articles. I'm not going to finish them today. Now, this is a kind of shocking article that folic acid may help lower risk of suicide attempts. It's amazing finding because I was surprised to read about this. And they had a study that looked at 867,000 adults and showed that I was startled. Dr. Ivy, Dr. Callender, you ever read anything like this before? That folic acid?
Never. If there's an upside, there must be a downside too.
Folic acid is pretty light stuff. It doesn't have a whole lot of side effects. But it's interesting that you look at the data. Yeah, and suicide now is becoming remains one of the commonest causes of death, especially in younger people. And for some, it's the number one cause in certain age groups.
I'd like to see that study.
Yeah, well, it's something that you would never guess. Of all things, folic acid. Yeah. But
like John was saying earlier, these underlined statements in blue is where you can go and get the research.
yeah, you can look that up, right? Okay, but it is pretty shocking that something
Go back up.
Something as simple as folic acid would do that. Yeah.
Yeah, go back up a little bit more where I saw it.
Well, I think when you have this at your leisure, so you can go back and look at these data to see what Of course, they give you the numbers, but it's nothing like reading the article to see what they're talking about. How does it help? That's a good question. Here again, the vitamin B levels. Ms. Stevenson talked about her vitamin B levels being low, and but no mention about folic acid. That's interesting. So it's food for thought. I think we'll see more articles like this to help us understand how in the world can folic acid decrease the likelihood of suicide. But
I've been taking folic acid for years. That's because I'm vegan, and it helps with vitamin B. I like it. You know, I can't really report any side effects or any, but I've never once thought of suicide.
well, we'll have to wait and see what time will tell us about this. Of course, now that we got this 988 line, maybe that'll help as well. Okay, next article, please. This is an interesting article that talks about vaccination shortens the COVID illness and makes you transmit less viruses. And this article talks about why we need to be vaccinated and also have the booster shot. And if you had the second or third booster shot, you have fewer symptoms and you spread the virus much less. That's what the studies are showing. I think it's good news. For those of us who are vaccinated, those who are not vaccinated, it may be another question. Of course, one of the concerns is that not as many people as expected have gotten the second and third, especially the third booster shot. And so we're trying to get more people to get the third booster shot while they get their flu vaccine. So I think most everybody on the line has gotten at least a second booster shot, right? And most of us have also gotten the third.
Yep.
Yep.
Yeah.
Saturday.
Yeah. Good. Well, it's amazing how fortunate we are that we have the vaccine. There's still some areas in the world where vaccines are not readily available.
Sorry, can I ask you a question regarding the booster shot? My son, and I was going to check with their pediatrician. Well, one is now 18, so he's not a pediatrician. But they got really sick, like really sick when they had their booster shot. So I was thinking about, should we do it again? Do you know, like, I hear some people get sick, and I've heard, like, if they get sick, that means the booster shot is working in their system. Well, they have a higher immune system, so that's why they're that sick. Do you think they'll get, I mean, I know you won't be able to tell. What are your thoughts about getting an additional booster shot and getting sick like that?
Well, I think that one of the things that I think many people do not do, but should think about doing, is that when you get a booster shot, you take the Tylenol or whatever you want to take. Tylenol is recommended, but you can get Elavil, Aleve. And I take it an hour after you take the shot. And if you get any symptoms, you take the Tylenol or the Aleve every 4 to 6 hours to deal with the side effects. Because I think it's unwise just to accept all of the side effects of the vaccination without taking medication.
That's what I told him.
And medication is relatively safe. So that's my recommendation. An hour after the vaccination, and anytime you get any of the symptoms, whether it's fatigue or headache or any of them, you take a Tylenol or Aleve every 4 to 6 hours with the symptoms. The fatigue is one of the biggest problems, headache, fever, and all those things occur. But don't be reluctant to take Tylenol to relieve the symptoms.
Okay, because I was thinking all that stuff mixing in together, and I don't know, it's just concerning. My youngest is like, I don't want to do that again, but I told him it's for the best. You know, you don't want to get sick with COVID.
Yeah, well, again, right after you get the vaccination, you take the Tylenol. I took if I had real bad symptoms, I took a Tylenol, extra strength Tylenol, but Aleve or Tylenol is helpful for those. My niece had exaggerated symptoms, and she forgot to take the medicine. She took the medicine and she was okay after that. So don't be reluctant to take the medication. And there's been studies that demonstrate because you have a reaction to the booster shot does not mean that you should not get another booster shot. You just should take medication to help you with the side effects of the medication.
I agree with that wholeheartedly. Everybody in my family has taken Tylenol after their immunization, and it's worked. It's been effective.
Dr. Callender, I guess I'm lucky. I've never had any side effects from any of the shots or the boosters. But my question: can somebody explain what the shedding means exactly?
Yeah, that means that you spread the virus. That means that you're spreading COVID.
But shedding, what's the mechanism? Is it aerosol? Or?
Yes. Yes. Yes.
Okay.
And so they're saying that you spread less, you aerosol less after the booster shot. Okay, now this is an interesting article that actually identifies that there's little evidence that male fertility is actually decreased by COVID. And it certainly interferes with your ability to procreate or have sex because your libido is maybe down. But in terms of your ability to have a child after you've had it, after you've gotten over it, there's little evidence to demonstrate that male fertility is decreased. But anyway, this whole article talks about that, looks at all of the data, and found that within 60 days of COVID, that people were less likely to conceive, but after that, there was no difference. So in other words, while you're under the effects of COVID, it may interfere. That's probably true. We'll never get sick with anything. But the long-term effect of it is negligible. Although it may be suggesting that while you're sick, maybe you should not try to have a baby in that sick process. But and the long-term effects are not there. But anyway, most of the studies that they've done, they looked at 2,000 U.S. and Canadian couples, and they looked at others, and the long-term studies that there's no long-term effect of this on fertility. Although, as I said before, if you decide you're going to have sex during the illness, the sperm count may be lower, and fever and all that may contribute to it. But after it's gone, that is no longer the case. And yes, there have been people with COVID who have had testicular swelling and other instances, but the long-term impact is not there. So men and women, if you after COVID is over, you can still procreate as well as you did before. That's the bottom line. And many people, when they're sick, they aren't that interested in having sex, but some women believe that men want to do it regardless. So they think that having a penis requires you to use it, whether you should or not. That's what some women think about us men. Is that right?
Oh my goodness.
True that.
Carol, shut up. See, we're the only husband-wife team on here, man. You gotta be cool.
No comment.
Well, here's another plug for cold showers. I just Googled, do cold showers increase sperm count? And the answer, Google's answer was, this doesn't mean that cold showers do anything to improve fertility, though. Simply taking fewer hot showers boosts your sperm count and quality, since heat in general affects sperm production.
Interesting.
I don't think anybody in here wants to become pregnant. I think we have too many Sarahs on this. So maybe.
Okay, we'll move on. This just shows that long COVID at 12 months is present at 18 months as well. And this is a problem that is becoming more and more an issue, the long COVID, which persists. And it's not really clear why some people have long COVID and some people don't. But it is a chronic illness, as a new chronic illness that we have come to face. And we aren't well equipped to know how to handle it. And I think that eventually we'll find out why long COVID occurs in some people and not in others. But right now we don't know, and we're hopeful that vaccination will protect against it. But I don't think we have enough information to say anything more about it. But it is now considered another chronic illness that is a new one. You see the problem these patients are still having. This is just an article about medication to avoid with Paxlovid. I think the data has made it clear that if you over 65 and you have COVID and you become symptomatic and don't improve within 24 hours, that you should take Paxlovid. There were concerns about certain medications that you should not take when you're on Paxlovid. And there are there's side reactions that, and there's certain drugs that they identify in this article that should not be taken if you also are taking Paxlovid. So that during the time you're on the Paxlovid, there's certain medications that they list shortly that you should stop for the 5 days you're on the Paxlovid. And the ones that are more common are the anticoagulants. If you have auricular fibrillation, you're on the antiarrhythmic. And those are two of the medications that you need to stop while you're on the Paxlovid. Now Paxlovid is only 5 days anyway, so So for 5 days, you need to stop that medication and then resume it after you stop the Paxlovid. There's also, keep going down, you have a list of those medications, but there's also evidence that the phenomenon that was made manifest with Joe Biden and Tony Fauci is not a cause of concern, and that one should not worry if one has what appears to be recurrent symptoms after Paxlovid, because they're going to go away. And they concluded that most of the reaction was not because you were reinfected with COVID, but because you had a strong immune response to the virus. And so it required no other treatment. Keep going down because you haven't got to the end. And here's the drugs that they talk about: anticonvulsants, chemotherapy, immunosuppressants, anticoagulant, antiarrhythmics. Now, you can't stop your immunosuppressant. You're a transplant patient, you can't stop your immunosuppression. So you just have to take that, because otherwise you lose your transplant. But the other medications, you're encouraged to stop if you can. Okay, next article. This is, I thought of Pearline Freeman because she's a nurse and she had a patient who had monkeypox. And this is a story about a nurse who, with an accidental needle stick, became the first case of occupationally acquired monkeypox in the United States. Of course, we know that you're not supposed to recap needles anymore. At least, at least that's why they tell you that you don't recap. You just, but anyway, she was trying to recap a needle, and she stuck herself. And the first. Well, so this is just proof that if you touch the lesions yourself, and of course you stick yourself, then you can get, it's another way you can get monkeypox. I recall that, I don't know if Pearline is still on the line, but she left the room when the patient
here.
came in. Oh, yeah. Are you aware of this case, Pearline? Were you aware of this case?
No, I wasn't.
Okay, all right.
Are you aware of the case where the nurse had a patient who had monkeypox and the nurse left the room and didn't come back?
Oh, yeah.
That was
That's
you.
Pearline.
Yeah.
Oh, yeah.
Yeah, but Dr. Cal is talking about the case in Florida.
No, I wasn't aware of that one.
Yeah, that's, yeah. If it can happen in medicine, it does happen. So, okay, is this the last one or what? Oh, this one. Yeah, well, it's almost 10:30. Scientists grow human brain cells in rats. And this is all done in an effort to see if we can study brain diseases in animals, so we can make modifications in animals that we can't make in humans. And so this is a way of using the rat model. This has been done in many other areas, but not for the brain. So this is a new effort to see if we can do research on brain cells, human brain cells in animals, and see if we can then apply that to human brains. Whether that's the case or not remains to be seen, but anyway, this is the first effort at doing this. Any comments on this?
Yeah, I have a comment. You know, modern medical science is going crazy. with experiments. I'm telling you, but I mean, it's all for the good. You know, I've never heard of a organoid, and that's what was used in this particular article, an organoid.
Yeah. Yeah. Well, we'll see if it works. You know, theoretically, it might be of help. We shall see. But yeah, your analysis is probably correct. uh, okay, well, I think this is an idea of what can happen. Of course, you know, with stem cells, there's so many things that can happen with us doing genetic altering. You wondered what's next? Well, here it is. Okay, any other comment?
Mhm.